Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
Have a longer life, and said the one thing that was common to all of the super ages was not genetics. As you remember, Darryl talked about the epigenetics and all that, and so it appears that the one thing that is common and helpful to all people who live beyond 70 is exercise. Uh, and of the exercises that he talked about, the exercise that was of great importance, of course, is the heroic exercises, but he also spoke about resistance exercising, weightlifting, and other things, and incorporating squats and all the other aspects of it, in addition to avoiding uh, processed foods. And so those were the things that he felt were most important in the aging process. Not the genetics as we often like to talk about it, but the lifestyle we live, uh, the food we eat, and exercising. I thought that was an interesting because he went into it thinking that it was genetics, but then when he finished his study, he realized it was not genetics at all. It was the lifestyle, and so Lucy, you had a comment?
Yes, there is a long running longitudinal study that we've spoken about in the past from Harvard. And the first cohort included John Kennedy. And this was just looking at lifestyles or development in men. And this is definitely white men, wealthy white men, or white men that have had access to both. And what they found out was that it wasn't genetics. And like you said here, exercise, but it was also relationship. And people who had long-standing relationships that invested in relationships far outweighed those with a more positive genetic pedigree. So, it's important. This group, 50 years of this group has added life to so many. And so it's important. I guess if we walk with our friends, maybe we will get to the point that he just takes us like Enoch.
Darryl, you're next, and then John Buchanan.
Yeah, when it comes to exercise, swimmers have a 50% more less 50% lower mortality rate than runners.
Thank you for sharing. That's interesting. Buchanan?
Yes, going back to the oral cancer situation, my dentist, and it kind of shocked me. My dentist does a survey at least annually for oral cancer. So I'm really glad, Janice, that you shared that because it's not a joke. I mean, I thought he was, kind of off base, but thank you.
Yeah, I appreciate that too, because my dentist also does the same thing. Why are you doing that? And it's a part of their regular exam now to check for oral cancer. But it's something we all should think about.
John Tatum?
Yeah, before we get started, last week we talked about an article about Alzheimer's on the front lobe of the brain.
Yes.
Yeah, I just wanted to make a note about that after that session was over, I found out that Bruce Willis the famous actor, has that exact disease.
Okay. All right.
Like
Who's Miss Willis?
Bruce Willis is a famous actor.
Oh, you mean Bruce Will? Oh, yeah,
Willis.
right, right. He's the one that made the diagnosis uh popular because yeah, that's right. He was one of he along with I also have a singer in our group who had the same diagnosis, frontotemporal, and they now have recently there was an article that identified a genetic basis for the diagnosis, which is brand new. It hadn't existed before. Yeah, Bruce Willis. Yeah, okay, yeah,
Okay.
the great actor. Right. Okay.
Yeah.
Right. Okay. The other thing that was an article on the fact that most of the people who are involved with computers and AI have a 58% uh, decreased likelihood of getting Alzheimer's. So that the more mentally agile you are and conversant with the computer age, the less likely you are to have Alzheimer's. Anyway, that was an interesting article, as well as an article that talked about why we're having so much colorectal cancer in young people. And the answer was because a lot of the processed foods that we eat and the lack of exercise. And so, anyway, it's good to think about that. Also, and it's another article about sleep banking, indicating that if you think you're going to uh, have a tough period of time ahead of you, take extra few hours of sleep. And those people who sleep, get those extra hours of sleep, behave better and survive whatever period they're going through much better than those people who don't. And then finally, there was an interesting article. I thought of Dr. Carol Tatum in terms of toxic positivity, pointing out that sometimes when you have friends who have problems, just like your friend had oral cancer, uh, platitudes are not really that helpful. What is helpful is doing those things that are positive behaviors, like going to them with the doctor or helping them out with whatever goes along, rather than uh, expressing platitudes that what are called positive, toxic positivity. Uh, any other comments about the items I've mentioned? Any comments? Okay. If not, then I guess we can start talking.
One thing I appreciated what doctors should never say.
Yeah. Okay, that was an interesting article, and we talked about also the fact that we aren't as smart as we think we are, so we should avoid predicting when we really don't know what's going on, and it's good for the doctor to be more humanistic than ever before, and try to help the patient when he has a terminal disease or chronic illness to be able to uh, weather the storm the best they can without giving predictions that we really can't make. Okay, guess we can. Oh, Carol Tatum?
Yes, I was wondering, do doctors realize they're not that perfect? Or, I mean, do they ever get to a point where they think they know it all or something like that?
No, we never get to the point where we think we know it all.
Oh, okay.
I should say we should never get to the point where we think we know it all, because the most important thing in the practice of medicine is to understand who really controls life and death, and it's not us. We do the best that we can, and patients live in spite of us. Patients die in spite of us, and sometimes because of us. And so recognizing who's in control. What we can do is do the very best we can every single time. And that's our responsibility. Okay, this is an article that uh, my daughter, for example, would think is long overdue because although the Bible says uh, a drink is good for the stomach's sake, most of the data suggests that alcohol is harmful and causes cancer and many other chronic diseases and injuries and mental health disorders. And that often the best drink is no drink at all. And, and in Europe, they have gone to emphasizing the point that alcohol is dangerous and uh, doing without alcohol is probably one of the most important things you can do, and that it is a leading risk factor for disability and a major cause of more than 200 chronic illnesses. So I think as you go past all of these alcohol uh, places that sell alcohol, uh, we understand you have the right to drink, but keep in mind that drinking is one of the most dangerous things you can do. It's not quite as dangerous as smoking, but it's comparable. And this article talks about how they are really moving forward in uh, identifying the high risk of cancer associated with alcohol, as well as other chronic diseases. Any alcohol enthusiasts out there? And of course, there's medical articles that talk about the fact that drink too is healthy and it's good for you. And so, uh, Dr. Perez?
It's similar to how, I think what was her name? Angela Polk. I Can Handle It. How TV entertainment influences people. Smoking, how if you wanted to be cool, the movie showed people who were smoking, and it was glamorous and sophisticated for women to smoke. And then with TV, you see a glass of wine, red wine when you come home in the evening to relax. And it's such a setup, just such a setup.
Thank you for sharing, John Tatum.
Yeah, that quote that's in the Bible about a little wine for the
Good.
belly. I have a theory that in the Old Testament, the early days, the Dark Ages, um, the alcohol, uh, the alcohol was different than it is nowadays. The ingredients of the alcohol that we have in the stores now is nowhere near like what they were talking about back then.
Betty Blaylock, you're next. Thanks for sharing, John.
Yes, good morning, everyone. I just was thinking about listening to all of this, and the influences, like Dr. Perez said, from TV and all of that. But I have to truly say that my influence was my mom. And whatever she told me, that is what has stuck with me. And I'm just so glad that I had an older mom, I guess, or a mother grounded in religion and faith and whatever. But she told me about not drinking, not smoking, and no matter what influences I have had in life, and I've had quite a few as far as parties and going out and doing things, but drinking never crossed my mind. No, no, that was always my answer. And just like I remember she she used to say all the time that hair is your crowning glory. And so therefore, as far as cutting my hair, no, I, mom was it. Whatever mom said, Betty did.
Okay.
I still do.
Thank you for sharing. John Buchanan.
Yes, as far as when I was younger, a lot younger, I read all those Ian Fleming novels, all the James Bond. You know, it was intriguing to me, very exciting, and every one of those novels, you know, almost focus on smoking cigarettes. You know, and they really got into the the act of smoking and how cool. I mean, you know, James Bond, he was super cool. So I mean, if he was smoking cigarettes, I was going to smoke. I eventually became a smoker, and I smoked for quite a while until I, you know, heard that it was really bad for you. But you know, those influences that we get growing up, you know, it used to be on TV. You know, you just see the guys smoking, and now you can't drink on a commercial either. You know, you can't have beer or wine drinkers advertised on the TV.
Oh,
But
yes, we do.
huh?
Every day. You have malt liquor. You have. I don't recall a athletic event where they didn't talk about drinking alcohol.
Well, yeah, they talk about it, they advertise, but
And they drink.
but
And
they're not supposed
they share alcoholic beverages.
but they're not supposed to show, as far as I know.
Yeah, but they do. I mean, and I was noticing that and lamenting that. There's one wedding commercial where they show giving uh, beer at this wedding as though it's something desirable, which is alcohol is alcohol, whether it's beer or not. So yeah. As far as I'm concerned, they emphasize alcohol, especially on athletic events, far too much because it's not healthy. But that's just my opinion. And but the truth is that yes, they still advertise a little drink here, a little drink there, and especially on the uh, basketball things. John Tatum.
Yeah, that reminded me of another scripture in the Bible where Jesus went to a wedding and they ran out of so-called wine there and filled the glasses. But I still maintain that uh, the wine that he filled the glasses with is not the same wine that we drinking nowadays. And I see a lot of television commercials and soap operas, and every time they get to somebody's house, that's the first thing they ask: "Can I fix you a drink?"
Right. Yeah, I think that's unfortunate, but that's the way it is. And I wish it were true that they didn't have commercials that foster drinking, but they do. Darryl?
Yeah, I looked it up on AI about alcohol being stronger today. Yeah, it is slightly stronger. Beer is much stronger than it used to be. Wine is just slightly stronger than it used to be.
Okay, thank you for sharing. Dr. Perez?
There was a voluntary ban on advertising alcohol, I believe, since 1948. And it was a public it was the will of the public to do such. And you can see over the last decade or more that we're seeing more and more of it. It was an outcry from many groups, advocacy groups about drunk driving. But the lobbying and support of the alcohol industry has moved it such that these advertisements can be had and their products not boycotted. So it's the will of the people, similarly to what we're seeing in so many things, that if we stand up and protest, then those entities that are advertising it, or those channels or networks that are publicizing it, we boycott them.
Well, nobody's boycotting the liquor that they're showing on the athletic programs. They're fostering
Yeah.
alcohol drinking in all athletic events, and I think that I think it's not healthy, but it's what is the state of affairs.
Oh,
Betty
okay.
Blaylock and then Carol Tatum.
Yes, I just wanted to make the comment that what Dr. Perez said is true, but um, the one thing that has not come back so far are the smoking commercials,
Right,
because they did,
that's
it used
banned.
to be that's all you saw too, but they got them off, and so far they haven't come back. So
Right. No, as a matter of fact, the commercials on smoking are that you should stop smoking.
yes,
Whereas with alcohol, they're drinking and fostering
yeah.
drinking. Carol,
Uh, I was going to say, unlike Betty, I also grew up in a home that drinking was forbidden, even though my mother, toward the end, as we grown, she said, "Oh, you can have some," because her mother gave us some wine. But I was, the experience, what media, what society says really has a deep effect, because I turned 21, I was on a college campus, and every bar in town would give you a free drink, which health matters much. And I first I was going to go to every place that gave me a free drink, but I learned later better. But what I'm saying is, media does have a lot, and the rich and the famous, you go to their home and they sit around all day long drinking and talking about their problems. And I'm saying, if you come to their house, would you like a drink? Not soda or anything, but they all have it. And if you look at the soap operas, anything, everybody has a drink in their hand.
that's
So,
right.
unlike smoking, we haven't had. Like I was talking to my mother, she was telling me that even marijuana, and she was born in 1917, was popular. They even had songs about Mary Jane and everything. I said, they did? But before America and everybody else found out that smoking was detriment, her generation, they did smoke because it was a thing. They did not know it was harmful for their body. So it's just getting it out to the media like they did smoking, that is harmful for the body. They put it on the package, it causes death, but just like Adam and Eve, you'll surely die. Well, since you didn't die instantly, they'll continue to do it. So media has a lot to do with it. When they get this out about debunking that red wine is not healthy or is healthy, they always told us that red wine was the best thing for you. So,
That's correct. Yeah, they
and
still
so,
do. They still
so
do.
is it the best thing for me?
No, well, I think that alcohol is dangerous, uh, and I think that medically speaking, there is evidence that a small amount of alcohol is not harmful. Uh, but if you're an alcoholic, one drink is all you need to take you down the road. Just like to me, alcohol is as dangerous as gambling is. Gambling is lethal problem, but they on athletic programs they foster that, and that's as unhealthy as drinking. But that's something that they foster, something that we need to battle against. But the gamblers are winning just as alcohol is winning.
So I had to change my mindset that red wine is good for my stomach because I surely do like the sweet red wine. But anyway, I'm going to stop because it's dangerous. Okay.
Charles Davis, you had?
Yes, sir. One quick thing. You're speaking of that, and on military bases and ships, your large carriers and everything, alcohol is there. I mean, I mean, for the youth, it's freedom, and a freedom which we tried to learn then during Vietnam era. They cut the age back. At least they were trying to keep it at 18. Was some of what they said, but there was never any real restrictions if you were on base or if you were on one of the big ships or what have you. They're just certain times it's open freedom of alcohol, and the impact of what that has done to individuals and youth, I think, is still yet to be shown. There, and but again, it's open to youth, who are young, free alcohol, and as I said, I still think we are yet to see the end result of what that's going to do, and see now, even it's happening to the young females who become, who are more and more a part of the military also.
Thank you, Darryl.
Yeah, another term for alcohol is liquid courage. And when you're young and you're on a naval base or just being a young man, you need that liquid courage to step up to the ladies. When you're a young lady, you need that liquid courage to let the young man make his first move. When you get older, you need that liquid courage as a stress relief because there's so much stress in life. But learning how to deal with situations where you need courage, that's something that as human beings we need to learn, and we need to learn other ways to do it other than liquid courage.
I'll drink to that.
Okay, thank you. Let's move on. I appreciate all of the wonderful sharing that you've done. Let's go to the next article, please. This is an article about the link between vitamin D, saying that it is good for GI health. There's been a lot of talk about the role of vitamin D with kidney disease, vitamin D with many things, but vitamin D deficiency we're talking about. Because if you're deficient in vitamin D, it can lead to kidney disease, it can lead to overall bad health. And here again, we're showing that if you're vitamin D deficient, you can also have GI problems, diverticulosis, diverticulitis, etc. And so the importance of the article is that if you're vitamin D deficient, then you need to get vitamin D supplements. If you're not vitamin D deficient, then you don't need any supplements. Most physicians, though, as you age, particularly in people of color, will give vitamin D supplements. But it's something that has been long discussed, and as you can see here, the highest rate in African American population is 82% people of color have vitamin D deficiency. So for that reason, most of the physicians would put you on vitamin D supplementation because many of people of color are vitamin D deficient. So if you're not vitamin D deficient, you may not need a supplement, but if you're vitamin D deficient, you need the supplement. And how it's related to diverticulitis, diverticulosis, and colon cancer is something that we've had many articles about. Any comments or anybody who has ischemic bowel disease or is vitamin D deficient. Okay, well, I think there's
I am.
Janice.
I am. I take 50,000 units twice a week. And I'm glad it was picked up. Its contribution, after menopause. I know you all think I haven't reached there yet, but looking for osteoporosis and all those things that can protect us. It's important to talk about it.
Janice, you had a comment?
Yes, I'm vitamin D deficient. I think I've shared before that I've always had an issue with it. My doctor was concerned. And at that time, he told me the levels should be between 30 and 100. I would stay at 20. And I started taking the Citracal D, and I do take a vitamin D supplement every day. And I've reached 30. Every now and then when I go for my checkup, I might be 33, which he's happy. He's calling my high a new low. But it works. It works. And deficiencies, problems, I am having a problem that was discussed in here. So maybe it's related to that. I don't know. But I do have regular checkups. And so we'll see how that goes. But yes, I have very low vitamin D levels.
Thank you for sharing. Let's go to the next article unless there's additional comment. This is interesting that the telomere is the part of the chromosome that is linked to age to longevity, to living long. And this article is suggesting that vitamin D lengthens the telomere and therefore is can be associated with longevity. And so those people who are vitamin D deficient need to take supplementation. And so getting enough vitamin D from diet and sunlight becomes very important. Any comments? If not, we'll move to the next article. This is an article that here again we're talking about the GLP drugs that GLP-1 drugs that are influencing many aspects and many organs. We know it's the drug of the future, maybe the drug of today, but certainly the drug of tomorrow. And its benefits on the brain, the lung, the kidneys, and we're going to see some other articles that point out its impact on the bone as well, very meaningful. Prior to the GLP-1 drugs, we didn't have any medicine that could modify or prevent or decrease liver fibrosis. And this drug is one of the first drugs that is affected the liver positively. And so in the past, if you had a fatty liver disease, if it wasn't treated by handling your diabetes and your obesity, you would require eventually a liver transplant. But this therapy now means that we have a way of treating liver disease that we didn't have before. So we're making progress. Of course, last week somebody asked when, I think it was Patty DeLone that asked when we were likely to have it available for all diseases. And I had suggested it's going to take a while, maybe 3 to 5 years, but time will tell. Any comments on the GLP-1 drugs and their impact on the brain, the kidneys, the liver, the bones, etc.? This is the article that talked about now osteoporosis, and even gout can be protected against with the GLP-1 drugs. And so every month it seems like we're finding a new way in which the GLP-1 drugs affects us in a positive fashion. This is the first article I've seen that identified osteoporosis and gout as part of the uh, treatment, GLP-1s being part of the treatment for those conditions. Any comment? Any comment? If not,
Doctor,
yes.
yes, Dr. Cowler. A lot of the GLP-1 drugs are used for 2 or 3 different things, correct?
Yes.
Okay, so if you're taking it for one thing, does it also alter, say if you're diabetic and you're taking it for that, is it also going to reduce your weight if it's that drug?
Yes.
So say you're taking it for liver and you don't need to lose weight, but will it make you lose weight anyway?
It's likely. Uh, 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 and one of the side effects of the GLP-1 drugs is that it causes decrease in the muscle strength. So if you're taking that, you have to really continue to do rate resistance exercises and eat more protein because that is one of its side effects. Sarcopenia.
Oh, okay. Okay. Yeah, I just wondered since it was used for 2 or 3 different things, I wondered if you took it, was it going to affect 2 or 3 different things in your
Yeah.
body?
Yes, it is. It
Okay.
is. So, and that's an aspect of it that we haven't yet addressed because we don't know enough about it yet.
Okay.
I think as we use it for long term, we'll be able to find out some of the other ways in which it is not as beneficial as it is in others.
Okay. Thank you.
Okay, let's go to the next article. There's no. This is something that we had mentioned before that there's a now non-invasive spleen test that predicts liver disease. And why is this important? Because many of the ways we identify liver diseases are invasive. And this now is part of the non-invasive test that looks at the spleen. And by looking at the spleen, it can tell you that whether or not your liver is diseased or not. And so ultrasound looking for liver fibrosis and also ultrasound of the spleen looking for splenic fibrosis can be helpful in determining whether or not you have liver disease without the need of a biopsy or other invasive test. Okay, let's go to the next article. Uh, this is an article that talks about the fact that prior to these drugs, drinking alcohol was one of the commonest reasons why you had liver disease, liver cirrhosis, uh, hepatic cirrhosis, which was one of the commonest reasons why you needed a liver transplant. And with the treatment for obesity, it was a Roux-en-Y gastric bypass. Those people who drank had higher incidence of liver toxicity from drinking. And so this is uh, uh, an indication that we now have ways of treating liver disease that we didn't have before. And also, the people who have Roux-en-Y surgery for obesity, if they're taking this drug, that will help prevent liver toxicity. So it's one of the benefits of this. And then, as we talked about, the fibrosis caused by uh, fatty liver disease, this is part of the treatment for it as well. And what this means is that in the past, liver disease that was caused by fatty liver disease and other liver diseases, which were virtually untreatable except by liver transplant. Uh, we now have a therapeutic modality that is helpful, which we didn't have before. So I think it's important because if you have liver disease, uh, certainly stopping drinking is important, losing weight is important, and also the fact that we have these medications that are now helpful at treating liver disease and nearing end stage liver disease and reversing it. Just like we have ways of treating kidney disease at stage 1 through stage 3, that can be reversed. Okay, any comments, question? If not,
I
yeah,
had a question.
John Buchanan.
Yes, Kevin had varices, and I just wanted to get some clarification on what that meant.
Varices means that the veins in the esophagus are dilated, and they get so big that they bleed, they rupture and they bleed. And so patients who have liver disease, end-stage liver disease, and they get varices, which means dilated blood vessels in the esophagus, which bleed and can cause you to bleed to death if it's not treated properly. And I think he had surgery in an effort to prevent that, but he died from the surgical complications. But varices are veins in the esophagus that they get very much dilated, and when they do so, it can be a cause of bleeding, and actually you can bleed to death from esophageal variceal bleeding. Does that help you?
Yes, thank you very much.
All right. Okay. Okay, let's go to the next article, please. This is now the hepatic encephalopathy is actually a situation in which uh, products such as ammonia uh, are toxic to the brain and actually send you into hepatic coma, where you become unconscious and you can actually die. And so liver patients can have ascites, which is a lot of fluid and that causes your belly to be big, or you can have bleeding from the blood vessels in the esophagus, or you can have hepatic coma. And all of this is when you have that's a consequence of end-stage liver disease, a treatment for which is a liver transplant. Sometimes a portal cable shunt can be helpful, but sometimes that's not enough. And so I guess what this does is open the portal for treating liver disease and avoiding the need for liver transplantation in some circumstances. Okay. This is a new drug, one of the newest drugs that shows fibrosis reduction in cirrhosis, which has never happened before, and that's why published in the New England Journal of Medicine. And so as we get more drugs that prevent or reduce fibrosis, then the need for liver transplantation becomes less. And so we're making progress with these new drugs that are making uh, untreatable liver disease treatable. And this is an early study that has not yet been FDA approved, but it's a suggestion that class 3 study would be the next step. So this is just to let you know that uh, before, if you had the diagnosis of liver disease, it was a sign that you were going to need a liver transplant. But now we have ways of treating liver disease so that liver transplant isn't always necessary. Okay. Still, alcoholic liver disease is still one of the biggest problems and common causes of liver cirrhosis. Go to the next article, please. And this is an article that says that fatty liver disease, not the fibrosis, is more common in elderly people than we had suspected. 33% of a third of older adults had fatty liver disease, but were not aware of it, uh, which becomes important because we now have ways of treating steatotic liver disease, which we didn't have before. Matter of fact, one of Carol's good friends died of steatotic liver disease before she could get a liver transplant. In the old days, they thought people thought that if you had liver cirrhosis, it was because you drank, and they didn't realize that steatotic liver disease is non-alcoholic liver disease that can cause cirrhosis just like alcohol. And so people who are labeled as having liver disease often were labeled as being alcoholics when that was not the case. Carol?
I have another friend I'm concerned about. How do you get diagnosed if you have a fatty liver?
There are non-invasive ways of looking at the liver by ultrasound and other ways that we talked about here that can let you know that you have fibrosis in the liver. They have non-invasive tests now that they can do that can identify whether you have fatty liver disease and cirrhosis or not, which are non-invasive. You can always get a biopsy, but now we have ways of making the diagnosis without a biopsy.
Okay, what would make a doctor look at a patient and say, you need testing for fatty liver?
Well, you know, if you we have liver enzyme tests that if they're elevated is a first sign. We have bilirubin levels. We have blood tests that can identify that your liver is diseased. And those blood tests, if they're abnormal, then they would lead you to do the non-invasive examinations of your liver to see if you have fibrosis or fatty liver disease changes. Uh, of course, if you had symptoms, if you had uh, low albumin, if you had a lot of fluid in your belly or legs, those are signs, uh, early signs of liver disease that would make you get a test to look at your liver enzymes and then look at your look at other tests that can identify whether you have liver disease or not. John Tatum, you had a question.
Yeah, in association with all those things that you named as far as diagnosing this, um, is it true that some doctors can also uh, measure the size of the liver and they can see that the liver is inflamed?
Yeah. We have ultrasound that can do that, the CAT scan. And we have a lot of ways of looking at the liver to identify whether it's abnormal, whether it's too large or too small, or inflamed or fibrotic. So there are many ways of finding out whether you have liver disease, blood tests as well as x-rays and ultrasound tests and special liver tests that look for fibrosis of the liver. Dr. Perez?
And I guess that is what you're saying too, Dr. Calendar, that it's important for us who may have chronic illnesses to be vigilant about end organ impact.
Right. And of course, the symptoms of liver disease sometimes can be itching, can be, um, I guess, fluid. Aside having fluid in the stomach, your stomach is big, and having fluid in other areas in the hands, feet, while it's suggestive of kidney disease, can also be suggestive of liver disease as well. Ascites or fluid in the abdomen is one of the signs of liver disease as well. And of course, jaundice, eyes turning yellow is also another sign of liver disease.
Also, hives,
Sorry?
HIV/ES hives.
I didn't understand your comment.
Uh, coming down with hives is another way that you can suspect that there's
Well,
something going on with an organ in your body.
well, actually, pruritus or itching is a sign of it. Hives suggest that you had an allergic reaction to something, whereas itching uh, without any uh, other source is a common sign of liver disease. Itching. Yeah. Okay, let's go to the next article, please. And this is something that is brand new because primary sclerosing cholangitis is, for the most part, has been untreatable except by surgical means. And when you have this diagnosis, the need for liver transplant becomes imperative. But now we have a new drug that is able to treat this, slow the progression of it. And this is a new finding, and uh, we'll get other confirmatory tests to find out if this is something that can be FDA approved for the treatment of this disease, which in the past has been unrelenting and wound up with development of liver cancer or the need for a liver transplant. So this is we're in an era now where we're having more drugs that are capable of treating pathologies that in the past were untreatable.
I wanted to say something. I can't get my hand up. I can't do it. Of course, Dr. Calendar, you know I lived that with my
Yes,
primary sclerosing cholangitis. And
right.
it just meant during those years, from 1995 to 2020, constant doctor's appointments, annual visits, checkups, tests to look for cancer and other problems. But he got through it. And at the same time, he was communicating with the football player, I think it was Walter Payton, who had the same thing and passed shortly after being diagnosed. Mm-hmm.
Yeah. Thank you for sharing, Jen.
Mm-hmm.
I remember those days well.
Yes.
Yeah. Let's move to the next item. We're getting into now a blood test that can help you diagnose upper GI bleeding. Of course, one of the first ways you know you have upper GI bleeding, if you have black bowel movements. We call it melena. And when you have black bowel movements, it means that you have blood in your GI tract that comes from the stomach usually. In contrast with having red blood, which comes from the large intestine. The black stool means blood coming from the upper gastrointestinal tract, which is impacted by acid. But anyway, if there's a question about it, we now have a capsule that can make the diagnosis for you. Although the red blood or the black stool is enough, but in those instances where there's a question about it, we do now have a capsule that can detect blood in the GI tract. So, but the real issue is if you have a black bowel movement, that means blood. If you have a red bowel movement, that means blood. So it's just a matter of where it's coming from. If it's red, it's coming from the large intestine. If it's black, it's coming from the upper gastrointestinal tract. Yeah. So that's just food for thought and should you look at your bowel movements? Yes, you should. So you can because sometimes the bowel movement may be colorless, which may be indication of pancreatic cancer or some other kind of malformation of the pancreatic duct. So that you should look at your stool and you should know what color it is, whether it's brown or green or black or white. John Buchanan.
You already know my question.
No,
How
I
much,
don't. What's your
How much,
question?
how much does it cost?
Oh, well, this has not yet been released, so we have no idea. After it's gone through uh, and it's approved by the FDA, then it would be get to the point where it gets there. It's not there yet. John Tatum, then Carol Tatum.
yeah, we talked earlier today about the enlarged blood vessels in the esophagus. Um, so by looking at this article, that those enlarged blood vessels, when they bleed, that's going to be red, really.
No, if it comes from the esophagus or the upper or the stomach, it's likely to be black uh, because of the acid in the stomach. But if it's in the colon, it's going to be red
Oh, okay, thank
because the colon doesn't have any acid in it, and so uh, red blood means large intestinal bleeding. Black blood means upper gastrointestinal bleeding.
you. Got it.
Carol.
Once I went to a pediatrician and she asked me what was the color of my children's stool. And I looked at her in amazement because once I potty trained them, I didn't feel like looking at that anymore. They left it in the toilet. But um, they didn't tell me, as a young mother, that you're supposed to look at your children's stool to see what
Absolutely.
color it is. So I
Yeah.
don't know who gives that instructions, but I didn't tell my daughter-in-laws or anybody that you're supposed to keep looking at your children's stool or instruct them to look at it. See what
Yeah, that's very important because that makes the diagnosis of many diseases. The color of the stool, if it's brown, that's wonderful. If it's pale, it's not so good. If it's black, that's not so good. If it's blood, so yes, looking at your stool is something that everyone should do, so you have an idea of uh, of what's coming out of you. What goes into you is not necessarily that which comes out of you. So that if you the color of your stool does matter, and you should look at your stool to know what's going on with you.
I was just wondering, are there any other mothers on here that kept looking at their children's stool once they potty trained them?
No,
It, not as a routine thing to do.
no, no.
But it's good for you to bring
I did.
good for you to bring it up so that
Yeah.
yeah, that
Mhm.
they know they should. Yeah.
Mhm.
And I wanted to also note that a few veterinarians stress that. And I think the commercial about the farmer's dog talks about how the dog taking this new food has better poops. And that's because we have to pick it up. Before we didn't have to do it. So people look at the stool more to see the impact, and just use our pets as examples.
Okay. Any other comment? Thanks for those sharing that information. We'll go to the next study then, please. Yes, yeah. Kennedy's making things change. As you could see in the newspaper today that they'll prioritize the COVID vaccine for 65 and older and high risk. Healthy people will not be prioritized, which suggests that the coverage for COVID for them is not going to be the same anymore. Uh, uh, anyway, so the evidence, the uh, fact that Kennedy is now the Secretary of Health is going to mean a big difference in terms of how vaccinations are given in all aspects. So this new administration is going to change things and may result in having more infectious diseases, and it may not. We shall see. But it's going to be different. That's for sure. Going to be different. Any comments, questions about the way in which all vaccinations will be handled from this point on for the next 4 years, anyway? Betty
I,
Bella?
I guess in this case, it's good to be old.
That's one way of looking at it. Uh, okay, well, we shall see. We shall see. Next article, please. Now, this is an interesting question that came up is that should unvaccinated patients get organ transplants? And at one center, they denied patient a transplant because the patient was not vaccinated. So the question is that right? Is that fair? Or what are your thoughts? Anybody have any thoughts about the fact that unvaccinated patients were denied organ transplants? Is that the right thing to do or not?
I think it is because there's so many things that you have to do once you get your transplant. You got to take the medicines that they prescribe, go through the routine, and they educate you on about it, and they see psychologically, are you going to be able to carry out these things? Are you disciplined to do this? So if you're not even disciplined and thinking that they're thinking a surgery will help them, but nothing to help themselves like a vaccination, then I don't think they should get it because their mind is not set right on medical help that they can receive and what they must do. A lot of people think once they get the transplant, that's the end. That is not the end. It's just the beginning. So no, I don't believe they should get the vaccination because they're not embedded into the medical help which can help them.
Right, and then they're likely to get any of those diseases which would kill them because the immunosuppression makes them more susceptible. So uh, most people would agree with you, Carol, that if they're not vaccinated, they should not be transplanted because they're likely to die from an infection that wouldn't kill somebody who was vaccinated. And that was the point that was driven home by the ethicists as well as the transplant center. And so they refused to transplant an unvaccinated patient. Any thoughts? Any additional thoughts on this subject?
I had a question. Was this person refused to get vaccinated, or was it a situation where a vaccination?
Patient refused vaccination. Dr. Perez?
No, that's that's the point. Informed consent, and making sure that the information is appropriately translated to people, and the fact that good health information needs to be disseminated. And there are a lot of people who have received inaccurate information about vaccination. And our present Secretary of Health and Human Services
And as you can see, I'm
has
running a little bit late, but okay.
Davis, mute you. Okay, go ahead, Lucy.
has disseminated this misinformation. So it's important that people be informed about vaccination and the truth of it. It's not associated with kids being on the spectrum and other false um, false facts about vaccination and its connection to other types of pathology. So that's all I wanted to say about it. It's important that people be properly informed, and each case would be different.
Okay, any other comments about this interesting situation that is going to be more and more common as we have the Secretary of Health who is not in favor of vaccinations being mandatory. Okay, let's go to the next article. Now, this is something brand new because the treatment for diabetic retinopathy in the past has been the ophthalmologist being involved, but without a real FDA-approved delivery treatment for diabetic retinopathy. This is a tragic cause of blindness in 5 million people. And this is the first FDA-approved therapy for diabetic retinopathy. And it is well known that blindness is a consequence of diabetes is something that is difficult to treat. And so we now have a new treatment for it that may help millions of people. So I just want to let you know that this is new. It's not something that is it's been FDA approved now. So and I don't know what the cost of it is, John, but anyway, it's something that can keep you from going blind. So it's important. Dr. Perez?
My mother was a blind, non-transplanted, diabetic, and um, this is just 45 years too late.
Yeah, yeah. But I thought it's important to let people know that it's out here because this, as you said, this is brand new. So yeah, diabetes is a disease that is as malignant as any cancer if it's not treated correctly and it's not monitored. These days we have insulin pumps and other things that can help regulate diabetes, but in the past years that was not the case. John Buchanan?
Yes, this treatment is an injection into the eye.
No, it looks like it's something that is given continuously IV. It looks like, yeah. And it doesn't really, it looks like it is given intravenously, but it's hard to tell. The impression is that it's given intravenously. Because
I just want to interject. This is so important. And our present administration is shutting down so much research. And it is so important that we move forward, that we continue to have research that's done against shutting it down so that we can give a tax break to already wealthy people.
Well, I think it's a very important point. As you know, NIH's budget has been cut in half, so much of the research that was done before is not going to be done in the future. So uh, we need to really remind our Congress people that we're going in the wrong direction. Dolores, did you have something to say? No? Okay. All right. Let's go to the next article, please. This is interesting. As a doctor on airplanes, this is from the UK, but in the United States, many times when I'm on a plane, they ask for help if there's a doctor in the house. And we do have rules in the United States where you cannot be held accountable for what you do under those circumstances. The European law also uh, obligates the doctor to assist, but they're not mandated to help. But the Good Samaritan law protects you from being held liable for what goes on. Onboard equipment is essential and has a minimum standard with an emergency medical kit. And one of the things that they don't do is for if you're a doctor, they don't really ask you what your preparedness is. They just ask you, are you a doctor? If you're a doctor, they expect you to help out. And I knew what I was doing. Experience. They just ask you if you're a doctor, and they presume if you're a doctor, you know enough to help. Oops. Yeah, I forgot to plug in my battery. I got to plug that in. Okay. Okay. Uh, then, of course, there are situations where they have to get telemedical support, and then sometimes they have to land unexpectedly. I'm going to plug in my computer. I'll be right back.
While Dr. Calendar is away for a moment, I was on a plane. I had a heart attack. And I was on a red eye coming from San Francisco to DC. So I was grateful for the help that I received.
How did he help you, Lucy, Dr. Perez?
The miracle was, as a pediatrician, I was the only one who wanted to sit next to a woman who had a baby on a red eye from San Francisco.
Oh, really?
Yes. And because of that, the woman was up all night. So when I broke out in a sweat, having the heart attack, she called she was awake. Had I been someplace else next to other people who were sleeping, I would have died. And so she, I don't know what else happened. I remember when they put the oxygen mask on me, and they brought the plane down in Chicago.
Really?
And they sent me Vernal G. Cave's sister-in-law happened to be on the plane, and she got off with me. I believe they sent an EKG to you or to one of the cardiologists that had seen me at Howard and knew that there was a significant change. And I remained at Resurrection Hospital in Chicago for a week.
Wow, what a story. Amazing.
You were the doctor on board, though.
Yeah, but it was a woman with a baby. And I was the only one. Nobody wanted to sit next to her.
And that saved your life, huh?
That saved my life.
Wow.
I wonder if these airline stewardess and other people on the plane have training for CPR.
Yeah, I don't know. I don't know the answer to that question.
I think it's required. It's required. They have to know the electronic device.
Yeah, that's correct.
CPR there's nothing to do with the electronic device. You're talking about the defibrillator.
Yeah.
Yeah, they have to maybe if they have a defibrillator, then of course that they would need to be trained. But CPR is something they would need to be trained on. I don't know because most of the situations that I've been involved in didn't require CPR. Darryl?
Flight attendants are required to receive CPR training in the United States.
Okay. All right. Thank you. I know even in churches, most churches don't have defibrillators. If they have them, they aren't trained to use them, and it's something that should be part of. For example, in our church, we have a defibrillator, but nobody's been trained to use it. So, and it's something that needs to be looked at. Betty Blaylock?
Yes, I know the nurses at our church have to be trained in CPR. There's not a defibrillator at the church, but the nurses have to have their CPR training and keep it up to date.
New Bethel Church has a training session Saturday at 10 a.m. on well, you already have to be CPR qualified, but the training for the defibrillator is going to be on that day. I mean, this Saturday for us there. So just thought I'd throw that in.
That's great. That's great.
And also Narcan. We're going to do those also.
Oh, really? Good. That's great.
Hallelujah.
That's wonderful.
Hallelujah.
Wonderful.
But Charles, please tell them why, because there's a member of your congregation and I know he probably is that. He's an ordained minister. Don't you have the chief medical somebody something at your church?
Yeah, yeah, one of the doctors from Howard. He's from Howard.
Oh, Mitchell?
Yes, sir.
Yeah, he's the president of the hospital.
Yes, sir.
And
Yes,
he
sir.
is the incoming president of the National Medical Association.
That's right. Yeah, right.
Yes, he is.
Yes,
And
yes.
that's why New Bethel is getting that. I assume. I know you should never assume.
Yeah, yeah, yeah.
Assume
Well,
that
that's
is
His
wonderful.
impetus, I'll just say that. Okay.
okay.
That's wonderful. Yeah, that's great news.
Mhm.
Okay. All right, let's go to the next article, please. It's amazing how intimate that has been with us. How about that? Now, this is something that is kind of disappointing that only 1/4 of sunscreens on store shelves are safe and effective. That's tragic because, as we know, sunscreening is very important to protect from skin cancers. And to hear that the sunscreens that are available are uh, not safe and effective is frightening. Uh, because especially for white people, the melanoma as a consequence, and ultraviolet rays are very dangerous. John Buchanan.
Yes. In addition, they're saying that some of these sunscreens penetrate the skin and get into the bloodstream. But in my case, as a scuba diver, I've seen that a lot of these sunscreens contain benzone, and that kills coral. And the coral reefs are the source of major source of the seafood that we get. So to me, it's really, really important to have sunscreen that is also reef safe. Thanks.
Any other comments? Thank you for sharing. Yeah. Next slide, because this should be the last slide. It's 10:30. So this is an interesting article that I imagine we all dream. But it's funny, they say that young people recall their dreams better than old people. Um, and the question is why, and it's, of course, in the Bible, talk about dreams, and Daniel, of course, was the great interpreter of dreams. Joseph was interpreter of dreams as well. And why do we have dreams, and what is the importance of dreams? I'm not sure I know the answer, but I think, do we all dream?
Mm-hmm.
I know I have many dreams and nightmares, and uh, uh, so it's something that, and there are people who daydream as well as night dream. So, um, but this article says that it's the younger people remember their dreams more than us older folks who dream, and and you wonder why some people have dreams and they never wake up, and you never know what they jumped. And Betty Blaylock.
Yes, my husband and I always have that discussion about dreams. He is an avid dreamer and remembering his dreams. I always tell him I don't dream, but he says you just don't remember them. And just now, when you said daydream, some people daydream, I just turned to him and said, "Yeah, I daydream." He said, "Yeah, you night dream too." But I don't, I don't really remember night dreams every now and then, but I do daydream.
Yeah, okay.
And they actually have books out on interpreting dreams.
Yeah.
And actually, my mom used to say she could interpret dreams.
Really? That's
Yeah,
a gift.
yeah.
Dr. Perez?
There used to be a number book in Brooklyn.
Oh yeah. Oh yeah, that's right. Yeah, yeah. That's big industry in Manhattan and Harlem and yeah, yeah.
I think it's a form of a meditation.
It's interesting. Well, I guess you can have theories on everything,
I do.
but it's a reality. The question is, uh, what do you remember, and what does it have to do with the future?
Or the past.
Yes, right. Yeah. Okay. Well, thank you so much for attending and participating and sharing. Great session. I understand we're going to be off for next week. Is that right?
John Buchanan only is going to be off of that.
So we're going to have group next week.
Oh, yeah.
Okay. So you're going to show the articles.
Yes, I'm going to try to beat John Buchanan next week. Yes.
Well, just be John Tatum. That's all.
Okay, I'll do
That's
that.
good enough for us. There's only one John Buchanan. There's only one John Tatum. So both of you are great in your own ways. So we're blessed to have both of you.